Medics in the Democratic Republic of Congo are hard at work trying to save lives. Cases of mpox have been rising in Africa's second biggest country since January. Hundreds of people have died. In a healthcare system that has been blighted by decades of conflict and corruption, the rapidly increasing caseload is stretching health workers to the limit.
Donc difficulté toza ngeza ba kiss bilamba kolata et puis toza non payé. Motivation ezate mamsutu baninga koya lisute pona nini bakondima ba risque te sans quelque chose à main. Ya onto osenga gouvernement akanisa biso.
Symptoms of mpox include fever, headache, and a skin rash. It often clears up on its own, but can turn deadly in vulnerable groups like children, partly because of their less developed immune systems. Government records show that this year, nearly 9,000 children have contracted mpox in the DRC, over half of the country's total. More than 400 have died.
Les enfants dont l'âge varie entre de 0 à 5 ans. Donc c'est pour dire que ces enfants-là sont les plus vulnérables et les plus exposés que les adultes. Les adultes sont exposés lorsque ils ont commencé à être traités localement, ça veut dire chez les tradipraticiens ou ils sont partis dans les maisons de prière sans se présenter au moment opportun et à temps plutôt dans les centres de traitement pour leur meilleure prise en charge.
The DRC government says it has released $10 million to be used for public awareness campaigns, tests on suspected cases, and treatment. Early detection is all the more urgent given the emergence of a more contagious and deadlier strain of mpox known as Clade 1b, which is driving the current outbreak. It was discovered in eastern DRC earlier this year and is transmitted mainly through close contact such as sexual activity. But mpox has a longer history in the heavily forested Central African nation where the hunting and eating of wild animals is common. The first human case was reported in 1970.
Donc, c'est clair que la prudence, c'est sur les singes, parce que c'est quand même l'animal dont est issu d'ailleurs le virus, mais aussi les rongeurs. Mais particulièrement, la prudence, c'est pour les animaux spontanément morts, enfin qu'on trouvait morts, ou les animaux malades, quelle que soit la maladie. Si vous ne savez pas, ne mangez pas cet animal-là, ne touchez pas.
The US and Japan have promised to deliver vaccines to the DRC soon. The government is counting on the jabs to fight the outbreak and says it needs 3.5 million doses. But it will have to convince people to accept the shots. That's because a lot of misinformation was spread about vaccines during the COVID-19 pandemic. Health workers will also face challenges accessing people in eastern DRC. The region has been hit by deadly violence since 2021, with government forces fighting rebels who have captured several territories. This year's outbreak has spread rapidly across the country and to neighboring states as well. Cases have also been reported around the globe. The DRC remains the most affected, accounting for 96% of all cases and 97% of all deaths this year. The emergence of the new strain of mpox in the DRC and the spread of the disease to other African countries recently led the World Health Organization to declare the outbreak a public health emergency of international concern. That declaration is meant to mobilize resources to prevent a global outbreak. Chris Ochamringa, CNA, Kinshasa.